Good morning, and welcome to our third presentation in our six-part series of best practices during COVID-19, put together by our Safety, Health, and Wellness Council. I'd like to give special thanks to our sponsor, the Manitowoc Company, the Cranes Division, for their support and their sponsorship. The next in our series will be Dr. Rye of Prevea Health, who will be joining us on Wednesday, October 7th for some healthcare updates. So please mark your calendar. So moving forward, today I'd like to welcome Tom Fitzgerald. Tom is a safety and health consultant and an OSHA outreach instructor who founded Safety Fitz. He is a former HR manager with over 40 years of manufacturing, human resources, and safety and health experience. Tom will speak today on a paradigm shift, work, COVID, and OSHA. And I turn it over and welcome you, Tom.
Okay, thank you. Thank you for everybody for coming. I guess we'll just jump right into it. First of all, my credentials are here. If you want to email me for a copy of this presentation afterwards, please do so. Give you a second to write it down. Also, my LinkedIn profile is over on the right. You can just copy that into your, if you have the mobile application for LinkedIn, copy that in and it'll bring up my profile as well. My mission today is, first of all, I'll give you some guidance on what we're going to be, how to manage an employee COVID case as to OSHA recordability, or what we call in the business, those of you that are HR people, causality, what we call causality. We're also going to give you a little information on OSHA's current enforcement policies concerning their standards during the pandemic. First of all, maybe some of you remembered back last March and April, Smithfield was in the news a lot about their poultry business in Iowa. Also, another company called JBS was undergoing strenuous audits through OSHA. Since that time, about 42,000 COVID cases have been reported in the meatpacking business. Most of those OSHA recordables. 200 meat work. Oh, they want me to move forward. Okay. 200 meat plant workers have died due to COVID. 1,294 cases have been at one single plant, the JBS plant in Greeley, Colorado. As of September 13th, 2020, there have been 203 fatalities in the meat cutting business, and there have been over 8,000 employee complaints to OSHA from high-risk industries, including the meat cutting business. All hospitalizations and fatalities are workplace injuries, need to be reported to OSHA, of course. Note the statistics are for only the 22 states included in the federal plan, or what we commonly call OSHA. 28 states have their own state plans, and I don't have statistics on those. To this date, OSHA's only issued 2 fines, both to JBS and to Smithfield, and they amounted to a little over $29,000 combined. So I'm going to try to leave the politics out of this, but please realize that OSHA is very sensitive to politics, contrary to what they say publicly. Currently, they're under heat from all sides, both the labor side and the employer side, and they're feeling the heat, quite honestly. They have limited resources, like always. They were buried in worker complaints last spring and early summer. Those tend to be tailing off some, and they're starting to plateau to a great deal. Most of the current complaints they're getting are in the healthcare fields, and what we call, we're going to talk about this a little bit later today, in the very high and high risk employer ranks. OSHA has been focused for the last 6 months on those areas, primarily when it comes to COVID. They also say that we have not overly relaxed our standards and requirements, although there are those that would disagree with that. Their actions sometimes speak a little differently than what their words are. They've given their compliance, safety, and health officers, which we call CSHOs in the business, they've given them a lot greater discretion. My personal recent experience working with my customers, that I'm continually surprised in that they don't seem as zealous as they once were as far as citations during this pandemic. I've actually been shocked by dealing with customers when I initially had thought, oh my gosh, they're going to throw the book at us. And then we only get basically very reduced fines and slaps on the wrist, if you will. So they are considering the pandemic. What changes are new as far as a paradigm? What changes when a new paradigm happens? Well, everything changes, okay? So here's a scenario. You're an HR manager in a machining plant. It's December of 2019. Joe's a supervisor in your shipping department. Joe presents to you a doctor slip that says he has flu-like symptoms and he will need to be off work for 2 weeks. You give him his FMLA paperwork. Mary works closely with Joe and he presents similar paperwork 3 days later. Are you worried you have 1 or 2 OSHA recordals on your hands? Now, remember, this is December of 2019. No, you're probably not. At least I never did when I was in my HR, practicing HR. Oops, sorry. Get the wrong. Now, consider that you're now even now in 2020. Joe's the same thing, same scenario. Doctor's slips come in for flu-like symptoms. He'll need to be off for 2 weeks. And however, Mary works closely with Joe and presents similar paperwork. Are you worried you have 1 or 2 OSHA recordable on your hands now? And I would say maybe. Where before it was absolutely not, now it's maybe. So what's changed? Of course, we all know the answer to that. It's the pandemic. So the real question is, will things revert back when and if the pandemic subsides? And only time will tell. Who knows? I think not, in my opinion. Okay. First of all, we should go and look at what the law says. The law hasn't changed in these areas. And the primary law that OSHA would use, if they were to cite you for anything COVID related, would be the general duty clause. There's nothing in the standards that say you will protect people from something called COVID. So they would use this. And just to remind you what the OSHA general duty clause says, each employer shall furnish to each of his employees employment and a place of employment which are freely recognized, free from recognized hazards that are causing or likely to cause death or serious injury or serious physical harm to its employees. So basically it says you'll keep your people safe. The law says you'll keep your people safe. That has not changed, okay? Now, OSHA goes a little bit further now as we progress through the pandemic and has put 4 elements in place to prove that COVID is a workplace injury. Number 1, the hazard exists in the workplace. So does the hazard exist in your workplace? Number 2, the employer or its industry recognizes the hazard. So in your particular industry, is COVID even more so of a recognized hazard? For example, a hospital. Of course, COVID would be a recognized hazard to the employees in a hospital. Now, if you're Parker Hannifin, for example, where I used to work, is it a recognized hazard? Well, then we got to consider a lot of other things which we're going to talk about. Is the hazard likely to cause death or serious injury or health problems? Is there a feasible means that exists to eliminate or reduce the hazard? Okay. So if those elements are in place, then it might be a violation under the general duty clause of OSHA. All right. Also, we must remember how OSHA defines an injury or illness. In section 1904.5, which applies to all businesses, especially those over 10 employees, you must consider an injury or illness to be work-related if an event or exposure in the work environment either caused or contributed to the resulting condition or significantly aggravated a pre-existing injury or illness. Work-relatedness is presumed for injuries and illnesses resulting from events or exposures occurring in the work environment, unless some exceptions apply. One of those exceptions, by the way, is for colds. Because basically it says, blah, 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 there's a big table up there. You can see under 19.5B2 that it talks about the exceptions that are in the workplace. And one of those says very explicitly under 1905B2 III, the illness is the common cold or flu. You don't have to count it as a recordable. So in my opinion, what this does, however, other contagious diseases like tuberculosis, bursitis, maybe somebody in the medical field can explain to me how to say that. Anyways, hepatitis or plague are considered work-related. So again, illness for a common cold or flu. So in my opinion, the determination of that by a doctor is even more critical than it was before the pandemic. Okay. Further, how do I handle a case if it's not obvious where the precipitating event or exposure occurred in the work environment? Okay. In these situations, you must evaluate the employee's work duties and the environment to decide whether or not one or more events or exposures in the work environment either caused or contributed to the resulting condition or significantly aggravated a pre-existing condition, blah, blah, blah. Okay. Also, it says you must consider something recordable if it meets one of these recording criteria, which again, most of us already know are death, days away from work, restricted work, transfer to another job, medical treatment beyond first aid, or loss of consciousness. Those are automatically recordables. All right, if the contributing factors are work-related. All right. Are Joe's and Mary's case work-related today? The paradigm is indeed changed, and no longer can we just dismiss a diagnosis of a simple virus as not work-related. You just shouldn't do that unless you want to open yourself up to liability. The question is now more relevant than ever. Did Mary's or Joe's condition occur due to the conditions of the workplace? Now, these conditions, these are specifically what those conditions are. Are you in a very high or high risk industry? And we'll talk about what those are in a few minutes. Again, a good example would be a hospital. Are other employees become sick for the same illness? Okay. One of the things that people have a problem with in the meat cutting business is where hundreds and hundreds of people were becoming sick with COVID. It's hard for that employer to say that the workplace had nothing to do with that. Okay. What kind of contact with each other do the employees have? Okay. In the meat cutting business, people work very close together. All right. In your business, they may work farther and farther apart. So that might not be something that would contribute to the illness. Have you performed risk assessments, and are these, and with these results, have you put in place what we call hazard controls to remedy those things you find in the assessment? A good example of that is what we call PPE, personal protective equipment, a mask. A mask is a classic example of PPE, personal protective equipment. Okay. Are your employees complying with the controls you've put in place? I was at a customer's plant not long ago where they said they were making their people wear masks. I went out there and discovered nobody was wearing a mask. So again, OSHA would take that into account if you said something's not recordable and you have these controls in place, but yet your practice is that you're not. Okay. What kind of exposures does the employee has outside of work? Has employee traveled, for example? Has a family member got COVID? Those are all things that you can consider in evaluating the illness as work-related or not. What are workers' individual risk factors? Does this particular employee have chronic health hazards? Or are they diabetic? Do they have health problems? Are they advanced age? But, you know, whatever. These are factors you also can consider as well. What are the risks for the illness in the community you're in? You know, here in Manitowoc County, it might be one risk factor. It might be completely different down in Milwaukee or Chicago. All right. Has the employee recently traveled? We discussed that a minute ago. And in my opinion, with regards to causality, whether this is work-related or not, a medical doctor's opinion is even more critical than it ever was. And number two, what you really need, I can't stress this any more than I am right now, a documented process of evaluation is critical if you're trying to defend your employer from excessive liability. So I really stress that you have some kind of written process that you follow to evaluate all COVID cases. All right. This is an example of one employer that put together a questionnaire that they follow. You could do something like this, write up a whole procedure, blah, blah, blah. But the main thing is you have a documented process you follow. That's, again, the key word is documented. All right. Remember, OSHA encourages your employees to call them if they feel unsafe. You posted that in your plant in a conspicuous place as OSHA mandates. If you don't have this poster up, it's a willful violation. You're talking about hundreds, potentially thousands and thousands of $1 fine. If you don't have that poster up, and if you read that poster, it says, if you're an employee here and you don't feel comfortable, call us. All right, so remember that. You must still inform OSHA of all workplace hospitalizations, excluding ER visits, within 24 hours of all workplace injuries or illnesses. You must inform OSHA also of all workplace fatalities within 8 hours. Okay. Also remember this, some of my employers forget this. OSHA, if you get citations from OSHA, you have to post those in your plant so all your employees can see it. They're also a matter of public domain and public record. So anybody is going to see them. So if you think you can conceal this or whatever, you can't. You can't. First, another thing to OSHA is if you go on the OSHA.gov website, just type in www.osha.gov, you get the page on the left. If you click the little white box that says corner of the COVID resources, and you click on, what is that? On the left, the little left blue box, that'll open up the page on the right, and there's all kinds of information that will describe to you how OSHA is advising you to treat COVID, all right? And how they tell their CSHOs, their compliance officers, how to enforce it, all right? One of them is this guidance for returning to work, which is a large document that you can download in PDF and then print it if you like. Also, the factors of the if OSHA inspector comes to see you, what we call a CSHO, they'll use these factors to try to determine whether it's work-related. First of all, they'll try to look at your investigation or your process of how you made that call, whether it's work-related or not. You're not expected to do a very costly research project in this deal, but you need to do simple things like, number one, ask the employee how he believes he got COVID or she. While respecting the employee's privacy, discuss what the employee's activities have been. If they have been exposed to other people with COVID. And then you also need to review the employee's work environment for potential COVID exposure. You're supposed to use the best evidence that you have to make that determination. And the main thing is, we're going to talk about this throughout this presentation, is doing it in good faith. All right. Remember to document your investigation. They also have all these different posters that you can download on the OSHA website that you can post in your plant and give you direction on how to treat the emergency. Okay. They have 2 documents on enforcement that they've issued to their CSHOs, which are that are certainly available to you if you'd like to download them off the site. The one on the bottom that I describe on the right is the first direction that was given. Was effective in April and then expired on May 25th. And the top one was an updated version of that came into effect on May 26th of this year. And it's still in effect today, and it's the one on the right. And I use that for a good deal of the presentation I talking about today. All right. The evidence that COVID illness was contacted at work. The CSHO is going to look at, first of all, is it work related? He's going to look at these factors. Have several cases developed among workers, and do they work close together? If an illness is contracted shortly after lengthy close exposure to a particular customer or coworker, and it is a confirmed COVID case. Is the employee's job duties include having frequent or close exposure to the general public in the community that you live in? It's not going to be considered work-related if the employee is the only worker to contact COVID in their vicinity of the work, and his or her job duties do not include having frequent contact with the public in general. Also, employee closely frequently associates with someone with a family member or significant other who has COVID, is not a coworker, and exposed to employees during the period. So again, it comes down, what kind of exposure is the employee getting in the outside? If they don't have any exposure on the outside, chances are this is either, it may not be work related or may be. Okay, you got to look at that. All right. CSO should have give due weight to any evidence of causation pertaining to the employee illness. If after reasonable and good faith effort by the employer, if the employer cannot determine whether this is more likely than not an exposure at work, they don't have to call the OSHA recordable. All right. But what OSHA is really looking for is that you tried your best to make that determination. Okay, here's my recommendations. I call them the top 12. Continually perform hazard and risk assessments of all the hazards in your workplace, especially COVID. All right. When working on controls, use all the medical information available. Sources of the CDC, NIOSH, OSHA. They also use CDC and NIOSH information. NIOSH is the National Institute of Occupational Safety and Health. State and county health agencies, your insurance providers that you have, your company medical providers, preferably occupational health providers. Okay, I'll talk about that just a little bit more in a minute. If you do not have an occupational health provider, I would really recommend that you have one. In times like these, occupational providers are invaluable. Implement as many controls as possible in your business. Most importantly, these protect your employees, and that is always a required. Remember the general duty clause that you have to protect your employees. In addition, they may help your case when you're trying to determine an employee's illness is not being work-related. So the more controls you have in place is showing that you're trying to keep your employees safe, which is something that's only going to help your case. Have a pandemic response plan. Smaller employers may make this an addendum to your emergency action plan, which is required under OSHA. You're required to have an emergency action plan. Just add a couple pages on what to do in a pandemic. And there are several examples on the OSHA website. I can get you some, other people as well. But make sure you have that and you're trying to follow it the best you can. All right. If you're in a very high risk or high risk employer, like a hospital, you must also have what they call an infectious disease control plan. You need to have that. You can make that part of the pandemic response and the emergency action plan if you'd like. All right. Again, I can't stress this enough, have a documented process to evaluate COVID cases. And you want to try, just like you do in all injuries, try to find the root cause, what actually happened, what caused it, and how can I fix it. You may have to ask, you might have to make tough decisions. Okay, as you do this hazard assessment, for example, you might come to the conclusion you have to force people to wear a mask. Okay, but you got to keep your eyes on the prize. Remember, you got to protect your employees. Excuse me. Okay, you got to protect them. So you might have to make a tough decision. But then you have to go out and inform your people and tell them why. Not just make them, I can tell you from experience, just making a mandated decision and expecting everybody to follow it might not work so well. Okay. Prepare and train your employees. I can't stress that enough. Train. That's the key. All right. Network. None of us are in this together. We're all in it together. I don't know of anybody that's not going to help somebody else if they ask for help. So please, if you don't know, certainly ask. If you can't find the answer, ask. We'll help you. Also, if you don't have occupational health and safety resource in your facility, I certainly would advise, especially just like the occupational health provider, you consider getting one. All right. An OSHA visit may or may not be probable, but act as though it is imminent and be prepared. The interim enforcement policy is another type of policy they have, and it describes how the CSHOs will use all this. And again, it's intended for a temporary basis. It also says, and this plan says, where COVID has significantly decreased, OSHA will return back to its normal policies pre-pandemic. And the field manual they use is there, it's cited. Except OSHA will continue to prioritize COVID cases. For the foreseeable future, they get a complaint on COVID, they're going to give that extra points and raise it up on the priority list. OSHA will utilize non-formal fax investigation or rapid response investigations, meaning they'll try to do as much investigation as they can remotely whenever possible. And the area director, which is in Chicago for our area, Region 5, will also ensure that all CSHOs protect themselves by wearing masks, respirators, whatever is needed to protect themselves when they're out and about. Okay. In geographic areas where COVID is experiencing sustained transmission, the area director will also decide the following: continue to prioritize inspections using what they call imminent danger. There's 4 or 5 different levels when they get a complaint, and how they'll label that as far as importance of going investigating. Imminent danger is the highest. Okay, particular attention for on-site inspections at high-risk workplaces such as hospitals and other healthcare facilities is way up there. Particular attention also on workplaces that are experiencing high numbers of COVID cases and OSHA complaints. Meat cutting business, that's an example of that. Initial inspection meetings may take place remotely, probably will, all right? Not only for COVID cases, but I'm seeing with my customers, they're also dealing remotely with the typical safety and health issues we've had pre-pandemic. When resources are such that on-site inspections and remote inspections, they use this what they call rapid response investigation, meaning that they still jump in with both feet, but again, they'll try to do as much of that as they can remotely. And they'll utilize the fax, email, all that kind of cool stuff. Back in the old days in HR, we would call those kind of things desk audits, and that's what they most remind me of for you HR people. They remind me of desk audits. Okay, this is the way that all employers are being classified now. You're either in a very high, medium, or low risk category. The very high risk are healthcare workers like doctors and nurses, healthcare laboratory personnel that actually work with samples from infected people, and also maybe even morgues where they're doing autopsies on people that were affected and infected with the COVID virus. High exposure is to the next level. Might be people like, we're going to talk a little bit about a dental office that got some OSHA citations. Sometimes mortuary workers that aren't really involved with preparing bodies for burial. Some healthcare facilities where you maybe just be entering the room for a few minutes and leaving. So it's sort of like by task as well as employer sometimes. Medium risk are jobs that require frequent close contact with people who may be infected. This is generally the general public. Those who may have frequent contact with the travelers, for example, like if you're working in an airport, working for an airline at a ticket counter or something. Those and also those people that have general public exposure, such as in schools or with high population densities of people. Maybe a high volume retail setting, all right? That might be an example of a medium exposure risk if you're dealing with lots and lots of people. Okay, low risk is all the rest of us. You know, maybe we were doing remote work, or we have remote workers, office workers, manufacturing, industrial facility workers who don't have frequent or close contact with others. Healthcare workers providing only telemedicine services, and long distance truck drivers. These are some of the other exposure risk levels they look at that might raise those levels we just talked about a minute ago. I'm gonna read them all, but you can see some of them are typically where you're working with people quite a bit. Okay. When possible, a CSHO will obtain from the employer, number one, their written pandemic plan, and if they're healthcare or a high risk or very high risk infectious control plan, review the organization's hazard assessment and PPE analysis. You should have had these before the pandemic, but now they're even more critical. So they're going to be asking for those to see those. They're going to be looking for, have you reported any COVID cases? And they probably will ask you for your, they will ask you for your OSHA logs. So you want to make sure they're up to date. And then you want to be able to defend your reasons why you've put somebody on the OSHA log and why you haven't, especially regarding COVID. Remember, they might be there because they're following up on a complaint from an employee that had COVID and is unhappy about your decision not calling it work-related. Does this organization treat COVID patients? That's very important. They may ask for medical records as to COVID exposure. Now you got to be careful. All those HR people know HIPAA. OSHA also understands HIPAA, but again, within the HIPAA requirements, you have to supply that to OSHA when requested. And I think there is provision in HIPAA for that, if I recall. Do you require respirator use in your organization? Now, we're talking about respirators, N95 and above respirator protection. Face masks are not considered respirators, okay? If you're requiring N95 respirators and above, you have to have a respiratory control plan on 1910-134. It's always been there, and you're expected to be following along with that. Now, there is some levity, which we'll talk about enforcement, okay? They may ask for training records. Again, under the respiratory procedure or standard, you have to do training of people wearing N95 respirators. Do you have that? Is it documented that you have that? Okay. For high-risk organizations, do you have isolation rooms if you suspect somebody having COVID symptoms? In high-risk organizations, do you have procedures in place to transport sick employees? Okay. And what has your pattern of infection? I don't understand that one 100%. I'm not a medical person, but those of you that are, you know what I'm talking about. What's the pattern of infection in the last 30 days? Okay. And again, your occupational health provider can provide that for you if you're not familiar, or any other medical provider. All right. They've also given us some temporary discretion, and we're going to talk a little bit more about this. This has to get into what the CSHOs would be looking for normally. Number one, they're still required, the CSHOs, to make sure that we're following all the rules and regulations regarding recording illnesses and injuries. Ensure respirator protection for priority for healthcare workers in high and very high risk companies or risk occupations, excuse me. Accepting equipment certification on PPE from most countries. It was prior to the pandemic, if you had N95 respirator certified by Canada, we had to take a little close look at that. The best were certifications here provided by people in the United States or the FDA or somebody like that. But now they're accepting certifications from other countries, with the exception of the People's Republic of China. You cannot accept any certification from the Republic of China. OSHA will not cite an employer for not scheduling an annual audiogram. Those of you that have a hearing conservation program, you know that you're required to do annual audiograms. Those are suspended for the pandemic, okay? However, that doesn't excuse you for not having those prior to the pandemic. Will not cite employees for postponement of annual mandatory training on several safety topics, such as because of travel issues, visitor restrictions, social distancing. Some examples of those are what we call HAZWOPER, control hazardous materials, respirator and training certification. Let's be careful with that one. Again, the respirator program, you're expected to train new employees or employees newly assigned to using N95 respirators and above. They still need to be trained on how to use the equipment. But as far as annual refresher training, you can be a little lax about that if you're current prior pandemic. Okay. The same applies to medical fit testing and medical evaluations, which is required to be done annually for people that are required to wear respirators. Okay. But again, that doesn't excuse for not following the law before the pandemic. Historically, OSHA has discouraged web conferencing for what I do, OSHA Outreach, where I'm teaching people about OSHA in an informational basis. We were you could do it, but it was very hard to get permission to do a video conference via Zoom or any similar platform. But now OSHA's kind of relaxed that a little bit, and I just performed my first video conference outreach class last week down at LTC, and I taught a customer that was down in Sheboygan. Okay, and they never even in the room with me. Okay. Here's a facility. This is a dental facility in June that was cited, and they got cited $9,550 out of initial fines of $24,000. They reached an informal settlement. I'm not going to explain all of these. If you'd like me to explain these, give me a call and I'll be glad to do that. But they got fined for things. The whole safety world was all in a buzz about this because OSHA cited them for one. The very first one you can see is 1910-134, which is respirators. Well, they cited them, but they cited them because they've never done any training for respirators. And again, it's been required that you do it for new employees and annually forever. So they didn't get fined because they weren't doing it during the pandemic. They got fined because they just never did it, okay? And you can see the rest of these, all these fines that they got were for things that they should have had in place pre-pandemic. So this is not an example where OSHA came down hard on them. For things that they should be doing during the pandemic. Granted, the audit was done during the pandemic, but again, they weren't cited for anything that shouldn't have been already in place. Now remember, the thing that's important to remember, and we haven't talked about OSHA citations, these all go on this company's record. If OSHA should come back and find these same problems, they could be cited. The escalation is 10 times as much. So if I'm going, you see these are listed as serious violations, they will be called willful or repeat violations, which would, you can just multiply the fines by 10 almost, all right? So this is really, what is amazing to me about this case, I just bring this forward to show you what maybe an initial, again, this is public record. You can type in any company in the country and you'll get their OSHA record up. And this is a medical facility. They didn't have an infectious control plan, no HAZCOM procedures, no bloodborne pathogen procedures, and no first aid supplies. Okay, and I can't believe, I just find this hard to believe that it was a medical facility. Okay. So again, the buzz in the safety community, if all the blogs, safety blogs and stuff they're all upset about this because they thought OSHA came down too hard on this company. But if you do some digging, you'll find out this all should have been done prior to the pandemic. All right. The applicable standards are here. And again, this is for general industry where I mainly play. I only play in the general industry, a little bit in maritime, but these are the general industry standards. Again, if you're in construction or maritime, they have their own separate references in their book. Again, this is a general industry book. But remember, we all have to follow 1904 record keeping, whether you're in construction, maritime, agriculture, general business, general industry, or whatever. We have to follow 1904 record keeping, and we all have to follow the general duty clause. We all have to keep our people safe. All right. If you're really into stats, I'm just going to show you a few stats. This shows you the complaints they've investigated, where CSHO has actually went out. Again, these are only federal statistics. These are not state plan states. Remember, there are 28 states out of the 50 that are state plan states, and these statistics are not in those. Wisconsin is a federal state, so our numbers are in here. But notice that the amount of complaints in their investigations have kind of plateaued. They were really going up in the spring and the early summer, but now they've kind of plateaued. This is another chart they had on their website. By the way, all these charts can be found if you're really into stats. I want to look them up on this spot on the OSHA website. But you can see, just to give you some idea, in the industries that they've followed up on, you can see healthcare is number one, and it goes all the way down. Well, my picture's in the way of the far right, but you can see that gives you an idea by business category where they're doing it, and you can see healthcare is by far the number one. Well, I think the other one was auto repair shops on the far right. OSHA recommends controls. OSHA recommends that basic controls when COVID hazards are found in the workplace as part of your safety and health program. But they also want you to do these risk assessments. Some of the things they would like you to see you doing if they come visit or call you is promote frequent hand washing as a second alternative, use hand sensitizers, encourage workers to stay home when sick, encourage respiratory etiquette, cough like this, for example, provide tissues to employees, explore flexible work hours, including staggered shifts and break times, attempt to reduce employee interactions as much as you can, encourage working at home when possible. My son-in-law is a buyer for Mercury Marine. He hasn't been in his office in Fond du Lac since March, okay? Discourage the use of public or common phones, desk, and offices, and work tools. Maintain regular housekeeping. As an example, have on hand plenty of disinfectants, all right? OSHA would like to see those all in place if they call or visit, all right? Again, I talked about hazard assessment, and I'm not getting on here today to talk about PPE and controlling risk factors in the work environment. However, we talk a lot, and OSHA does as well, about what we call the hierarchy of controls. So if you see a hazard of any sort, let's just say sparks flying around in the environment, we're supposed to use a methodology to control that. And the first thing we do is look at elimination, substitution. We may look at making engineering controls that eliminate the sparks flying around. We may do administrative controls where maybe people are getting repetitive injuries. So we do job rotation and things like that. And the final thing we look at is PPE. This is what's called the hierarchy of controls. This is how we install controls in place and the priority they should have. We should always try to eliminate or engineer away if we can, okay? That's what that whole thing is all about. And it pertains to COVID as well. Guidance, here's some general thoughts I have about dealing with OSHA. This is, first of all, be vigilant, protecting your employees, know what is going on in your workplace and your community, okay? Perform risk assessments and implement necessary controls to protect your employees. Document, document, document. I have a rule that I tell all my customers dealing with OSHA. If you didn't document, you didn't do it. You simply didn't. As far as OSHA is concerned. Be transparent in your actions to your employees. There's no reason you have to keep this a secret. Share it with them. Let them know what's going on. I had another employer that I work with that decided to do the universal mask protection. Well, they didn't tell their employees, but didn't explain it to their employees. The employees rebelled. They didn't like it. Well, I'm sure I would either, which is mandated to me. Nobody explained it to me. When practical, allow employees to participate, encourage and use their input to seek buy-in. Employee buy-in here is critical. I can't stress that enough. Okay. Train, 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 and then train some more. Okay. You can't overtrain, especially with something like this. Ask if you don't know, if you need to get help. There's lots and lots out there. Okay. And network. None of us are in this thing together. So call me, call somebody you know from the Lakeshore SHRM Council, somebody on the Safety and Wellness Council, whatever. Call somebody and get help if you need it. Overall guidance. These are overall rules that pertain now, especially now in dealing with the pandemic with OSHA, but are always in play, in my opinion. Continually demonstrate good faith. OSHA is really looking for this thing they call good faith, that you're merely making a concerted effort to protect your employees. That's really, really important. Your actions should show that nothing is more important than the safety and health of your employees. Okay? Again, remember general duty. It's the law that you will protect your employees, period. And again, we just talked about general duty. It's the law that you keep your people safe. Always be professional when you're dealing directly with OSHA. They're professionals for the most part. You do it too, all right? Be cooperative, but careful. Limit information that you give to OSHA to what they request. Don't go overboard. Give them exactly what they ask for. I would stress you to be careful with anything more. Okay? Ask questions, but don't become defensive, and never argumentative. I was working with a customer a while ago, about a year ago, where they got really, the plant manager got really defensive and started telling OSHA, no. And it just turned into a fiasco. You'll pay in the long run if you do that. Just don't be defensive and never argumentative. Okay? Do what you say you're going to do. If you tell OSHA you're going to do something, you make sure you do it. Those of us that are in a lean world, or grew up in a lean world like I did, we use a term called PDCA, plan, do, check, act. So if you say you're going to do something, you do it, but then you go back 6 months later and expect the thing you said you were going to do 6 months ago, you're still doing. Because remember, OSHA can and will come back. And if they come back and see that you said you were going to do this and you didn't do this, it's not going to go well for you. All right? Critical, always act like you know what you're doing. That's one of my key points to my customers. Always act like you know what you're doing. Whether you really do or not, act like you do and get some help, all right, if you need it. But to OSHA, you want to project back to what we originally talked about, good faith, and that you're protecting your employees. And to do that, you have to show that you know what you're talking about, and you know what's needed to protect your employees. There's also a law that some of you are already dealing with called the Families First Coronavirus Response Act. I'm not going to go in great deal about that because most of you are probably already doing it. It's for employers under 500 employees, and it's only in effect till December 31st, but it basically gives pay up to 80 hours for people that have a possible COVID diagnosis. And there's some of the stipulations, all right? Okay, so going back to what we originally talked about, are Joe and Mary's cases recordables? One thing I know for sure is we cannot just out of hand anymore just say, absolutely not. This is a cold or flu, I don't have to worry about it anymore. Unless you have a doctor's slip in hands that says this is the common flu or the common cold, I'd be really careful about just carte blanche saying it's not recordable, all right? And I don't see that changing post-pandemic. So that's a new paradigm that we have to get used to and look at. Will OSHA come to visit us? Again, there's a lot of factors. I tried to go through those, a lot of them in a short period of time. But my swag, if you're a medium or lower risk employer with those kind of occupations, your rate of your possibilities of having inspection are probably a little less, because OSHA is so busy with the high risk and very high risk employers right now. So during the pandemic, I think your risk is slightly lower than it was pre-pandemic. I have dealt with OSHA 3 or 4 times recently where I thought they were going to throw the book at us. We were going to be in serious trouble here. I got called in because the employer thought they were in trouble, and basically they came out of it smelling like a rose. So I do think OSHA's given some, at least in my experience recently, I think they're just not as zealous as enforcing the standards for general safety things as they used to be. But again, be careful, they can change at any minute, okay? You have to be careful also if your rate of COVID is higher than the general community. So you need to keep track of that. So what's the rate of infection in your community? What's your rate of infection? Excuse me. If it's significantly higher, that means you've got a problem and you need to address it. Okay? And now I'm open to questions. They can ask questions now?
Yep. Chat or Q&A.
Any questions? You want them to talk or type?
Or do like chat.
So just speak up if you have any questions. None? I must really be either really good or put you all to sleep. I guess not. Well, I want to thank you all for your time today. I hope this was informative and helpful. Again, if you'd like a copy of my presentation, you can email me. The Chamber's trying to get this up on their website. It's about ready to go, but not quite. So if you'd like it before that, just send me an email, fitz@safetyfitz.com, and I'll be glad to get you a copy of this presentation out ASAP. Again, your resources are OSHA. If you want to learn more about this, I would certainly encourage you to go to that website. They have all kinds of stuff, including posters to post for your employees on what, how to wear masks, how to cough, and how to use the respiratory etiquette, as they call it. They got CDC, NIOSH, Wisconsin Department of Health. These are the Manitowoc and Sheboygan County Health Departments, your occupational health provider, your insurance company, Google, and certainly network. We'll beat this together, folks. Hang in there. That's it.